Yes, we always know that through the winter months, from the autumn into the winter, we start seeing more cases of respiratory illness in children, and RSV, so respiratory syncytial virus, is one of those viruses that we've already started seeing circulating. Now, in most children, this is quite a mild illness, and actually it can be quite confusing in terms of, are they RSV symptoms or are they COVID symptoms? So if any parents are worried, they need to phone 111 and seek advice. But the normal symptoms of RSV are, for example, a runny nose, a sore throat, and some noisy breathing. And there are simple things that parents can do in terms of the treatment of RSV. So this is a virus. Antibiotics won't work with a virus, but the simple things you can do. For example, sit your child upright. Try and get them to drink plenty of fluids. Try and get them, especially with babies, to try and think about, can you give them feeds more frequently, less volume. And indeed with babies, when they're trying to breastfeed or bottle feed, if they're having trouble, you can go and get some saline drops from the pharmacy, and you don't need a prescription for those, and you can pop them up the baby's nose, and that can sometimes help soothe the breathing. And then finally, another feature of RSV is you can have a temperature. And indeed, we would encourage you to if the temperature is bothering the child, you can buy over-the-counter medicines such as paracetamol and follow the instructions to help try and bring the fever down.
But of course, as you say, the worry is that it might be COVID. So how do parents weigh this one up? When do they decide to go for a swab?
If they are worried, they can phone 111 or speak to their GP for advice, because absolutely the symptoms can appear very similar, but both illnesses tend to be mild in children. That's what we're seeing with coronavirus and RSV. But if parents are worried, they can phone 111 for advice.
It is, of course, a balancing act, because on the one hand, if parents are complacent, you could have the spread of COVID, especially now that school has started. But the other side of the coin is, of course, that if parents are too quick to take their children to get swabbed, you could actually overwhelm the services.
It's really important that if you develop new symptoms, whether you're an adult or a child, and that being things like a new cough or a new change of sense of taste or smell, that you do have a low threshold and go and get tested, because we need to make sure that we are following self-isolation advice in terms of COVID. That being said, in terms of children and RSV or COVID in children, it tends to be a mild illness. Yes, we still want people to attend for swabbing. If it comes back as a negative swab, it could well be RSV that the child has got, in which case there are steps that parents can take. It is usually a mild illness, but if you are worried, you can always phone for advice.